Today, we're going to pull back the curtain on a really crucial, but maybe not so obvious role in the whole world of mental health. We're talking about the clinical supervisor. These are the people who mentor and guide our therapists, so let's dig into what it actually takes to become one.
It's a pretty simple question, right? But the answer is so important. I mean, the quality, the ethics, the real effectiveness of therapy. A lot of that comes down to the person who's overseeing the therapist's work. So, who are these guides? Well, they're the clinical supervisors. And becoming one is a whole journey in itself. It's about making that leap from being a practitioner to becoming a true mentor.
And here's what's really key. Becoming a supervisor isn't just the next automatic step up after you've been a therapist for a while. Nope, it's a totally distinct role that's all about teaching, about upholding professional standards. They're kind of like the gatekeepers, making sure that new therapists are competent, ethical, and totally ready to practice safely. Of course, you don't just wake up one day and decide, hey, I'm a supervisor now. There is a very formal path, and honestly, it involves navigating a pretty complex set of requirements. Yeah, this journey is basically paved with regulations. Every single state has its own rule book. You've got specific training hours you have to log. And on top of all that, you often need a national credential that you can only get through very specific approved courses. It's a lot to keep track of. So how does a therapist actually manage to check all those boxes? To make this a little more concrete, let's take a look at how one specific training provider sets up their program. This will give us a real-world peek at how these pretty demanding requirements can actually be met. Okay, so this provider, for example, breaks their training down into two parts. You've got a broad 30-hour course that gives you a big picture overview. And then there's a more focused 15-hour course for specialties, like substance abuse. This kind of modular approach is really smart because it lets practitioners tailor their training to their own specific career goals. But at the end of the day, the goal of these courses isn't just about learning for the sake of learning. It's about earning a credential that has real-world value and gets recognized across the entire industry. 14. That's how many states recognize one of the key national credentials. It's called the ACS, or Approved Clinical Supervisor. This really shows you the power of getting a credential that isn't just stuck in one state. It's a qualification that can actually travel with you. And believe it or not, that recognition goes even further. A single, really well-designed 45-hour training program can actually satisfy a whole bunch of different requirements, from the 40 hours you might need in Texas to specific standards in California and even educational benchmarks in Canada and the UK. I mean, talk about efficiency and broad appeal. So what's the secret sauce to that wide acceptance? Well, it's getting the official approval from national bodies like the CCE and its affiliate, the NBCC. You can think of them as the ones who set the standards for the entire profession. So their approval is like a seal of quality that tells licensing boards everywhere that this training meets a really high recognized benchmark. Okay, so what exactly do you learn in those 45 hours? What are the skills a supervisor really needs to have in their toolkit? The training really starts with the fundamentals. You learn about all the different hats a supervisor wears, the theories behind good supervision, and of course the practical methods for guiding a new therapist. And so crucially, you learn about evaluation, how to actually assess if a therapist is ready and competent. But it's not just the classic stuff. Modern supervision has to tackle today's challenges. That means getting really good with technology for remote sessions, knowing how to navigate incredibly complex legal and ethical dilemmas, and, this is critical, providing culturally responsive supervision that works for a diverse population of both therapists and their clients. Now, the content is obviously vital, but how it's taught is just as important, especially when you're talking about busy working professionals. So, the process itself is built for flexibility. You get to go through the material at your own pace, you reflect on it through writing, and then you have this great option for a one-on-one consultation with an instructor. It's a structure that's really designed to fit into an already packed professional life. And this might be the most important part of the whole thing. The goal here isn't to just test your memory with a bunch of quizzes. It's to foster a collaborative conversation, which is the absolute heart of good supervision. The training actually models the mentorship it's teaching. It's all about curiosity and deep learning, not just getting the right answer on a test.
Look, the journey to becoming a supervisor is rigorous, and for a very good reason. The impact of just one great supervisor ripples out, from the therapist they mentor to the hundreds, maybe thousands of clients that person will help over their career. It leaves us with a really powerful question to think about. What could the future of mental wellness actually look like if every single therapist had that kind of incredible guidance? Thanks for tuning in to this explainer.